Good morning, everyone. We're delighted to restart the session today. My name is Laura Peterson. I'm a professor of medicine at Baylor College of Medicine. I am director of iQuest, the Center for Innovations in Quality, Effectiveness, and Safety at Baylor and the Houston VA Medical Center. And I'm honored to moderate this session where we will hear from Dr. Peter Hotez. He's the founding dean of the National School of Tropical Medicine at Baylor, as well as director of the Texas Children's Hospital Center for Vaccine Development. He's an elected member of the Institute of Medicine of the National Academies, as well as the American Academy of Arts and Sciences, and has many other affiliations and awards. Notably, he was recently named one of the inaugural Time 100 Health, a new annual list of 100 individuals who most influenced global health this year. And Time refers to him as a science warrior, quote unquote, which I think is very appropriate for those of us who know him. He's a pediatrician and an expert in vaccinology and tropical disease. He's authored hundreds of peer-reviewed articles and editorials, as well as dozens of textbook chapters and some wonderful books, including a new one that we'll hear about today. So, Peter, welcome to the conference, and I'm so delighted to have the chance to talk with you. Let's start off with just talking about you being on the front lines of combating the anti-science, anti-vaccine movement. So tell us more about that experience.
Well, thank you, Laura. I hope everyone can hear me okay. I know it looks like a hostage video, but I'm actually I'm speaking this week. I'm a visiting professor at UCLA Geffen Medical School and their School of Public Health, Fielding School of Public Health, and so I'm in the hotel room at the conference center. So
glad you're safe, Peter.
No, I'm very safe. I'm very safe. Yeah. So first of all, thank you, Laura. It's an honor to be with you and you in all your accomplishments. It's a special thrill for me to have this conversation, particularly with you, Laura, Dr. Peterson. And a couple of things. So as you mentioned, I'm a pediatrician scientist, MD, PhD scientist. Develop low-cost global health vaccines. We recently developed a COVID vaccine technology that was licensed with minimum strings attached to India and Indonesia, reached 100 million people. And so we provide a proof of concept that you don't have to be a big pharma company to develop low-cost vaccines for the world. And then we have parasitic disease vaccines for hookworm anemia and schistosomiasis and Chagas disease. And all of that, I actually started as an MD PhD student in New York 40 years ago at Weill Cornell Medical College and Rockefeller University, and started making a hookworm anemia vaccine then. And now 40 years later, it's showing protection. And so that's often the time frame for a lot of these vaccines. The point is that part of my life was strategic, was planned, and that's what I wanted to do with my life. That's why I came to Baylor College of Medicine and Texas Children's Hospital almost 14 years ago to do this, and it's been an incredibly productive time here in Texas and at the Texas Medical Center. The unplanned part was having 4 adult kids, including Rachel, who has autism and intellectual disabilities. And as we can talk about, the original assertion against vaccines more than 25 years ago was that false claims that vaccines cause autism. And so I'd written this book called Vaccines Did Not Cause Rachel's Autism, which wound up making me public enemy number 1 or 2 with anti-vaccine groups. But it also gave me a front row seat to really understanding what this movement was all about. And the new book, called The Deadly Rise of Anti-Science, looks at how this became a political enterprise. And that's the relevance to today's symposium and I'm so glad Baylor College of Medicine and the Center for Medical Ethics and Health Policy have taken this on, because I think one of the things the book explores is how the heck do we talk about this? Because all of our training as physicians and scientists, for at least from my point of view, tells us we're not supposed to talk about Republicans and Democrats and liberals or conservatives and red states and blue states. But what do you do when the attacks become very partisan in nature, and how do you actually have that very uncomfortable discussion? And so with that introduction, again, thrilled to be with you and do a deep dive and talking about some very uncomfortable things that need to be discussed if we're going to preserve our profession as it is.
Right. So let's do dive into that. So I think as physicians, we're not necessarily prepared well to take on some of these partisan discussions that happen. Earlier panelists have talked about how to do that, in an individual one-on-one with patients, but you've really been on a national stage, and that's opened you up to many attacks. So, can you take us through your thought process about what to do when these attacks do become partisan? How do you prepare yourself? How do you coach others? And what's a game plan? What are some lessons learned?
Well, I think one of just to qualify my comments, one of the things I say is there's no real roadmap here. There's no right and wrong because these partisan attacks against biomedicine are unprecedented, right? We've never had to deal with this before. I mean, the climate scientists have been dealing with this for about a decade. In fact, I have a new book now I'm working on with Michael Mann, the climate scientist at Penn, that compares the attacks on climate science with the attacks on biomedicine, because actually it's not, the two circles of the Venn diagram don't completely overlap, but there's significant overlap, and they're coming from some of the same sources. And, and I try to thread the needle as best I can. I don't know I'm always necessarily doing it very well. I mean, what I say is, look, I really don't care about your political views. That's your right as an American citizen, and to speak out on whatever political views you wish to. That's very much ingrained in our United States Constitution. What I do say, though, is how do we figure out how to uncouple that from statements that are made that are actually going to endanger your health, that are going to put your health at risk? And for me, one of the prime examples is the anti-vaccine movement. So around a decade ago, the anti-vaccine movement acquired political leanings, and it really amplified first in Texas, where under this propaganda banner of health freedom, medical freedom, the anti-vaccine groups in Texas started getting PAC money, Political Action Committee money, from the Republican Tea Party to raise money for candidates to run on anti-vaccine platforms and to falsely accuse vaccines of being weapons of political control. And as a result, we started to get a steep rise in the number of kids whose parents weren't vaccinating them for school. And we are now up to over 100,000 kids not getting their full complement of pediatric vaccines like measles, mumps, rubella vaccine, or even polio or pertussis, and putting their kids at risk. And that doesn't say anything about the 700,000 homeschooled kids that some people think we have in Texas. So 700, what percentage of those are not vaccinated, right? We have no idea. They're homeschooled, right? So we probably have hundreds of thousands of kids not getting their vaccines in the state of Texas. And that's what came off the rails during COVID-19. And I wrote about this. I wrote about it in the book, The Deadly Rise of Anti-Science. I also wrote about it a little bit earlier in a paper in the Public Library of Science called The Great Texas COVID Tragedy. And it looks at the 100,000 Texans who died from COVID-19. So Texas led the nation in number of COVID deaths, close to California, but Texas is 30 million people, California many more, 40 million plus. And what it says is that of those 100,000 deaths, they're split equal before vaccines became available and after vaccines became available. So almost 50,000 Texans needlessly died because they refused to take a COVID vaccine, beginning with the Delta wave in the last half of 2021 and with the BA.1 Omicron wave in early 2022. And they refused COVID vaccines because they were told to. They were targeted by a pattern of political aggression. And here's where it gets hard to talk about because, and I said, I just haven't found a way to talk about it other than to talk about it So I talk about it, or I write about it. Not that I care about your political views, but if we're going to really be serious about saving lives, we have to at least report it and describe it so we can begin figuring out how to chip away at it. Because if we use too many euphemisms and don't really say it in an explicit way, then nobody knows what the heck you're really saying, and then we lose it. So what happened, what the numbers clearly show is not only those 40,000 deaths, needless deaths in Texas, but 200,000 Americans needlessly died overall, overwhelmingly in states like Texas, Arkansas, Oklahoma, Mississippi, Louisiana, Florida. And the numbers clearly show from Charles Gaba, the health analyst, confirmed by the New York Times and Axios and National Public Radio and others, that overwhelmingly, after vaccines became available, beginning with the Delta wave, overwhelmingly those deaths were in red states, Republican majority states. And the numbers also clearly show that the greater the percentage of Republican voters in a state, in a county, the lower the immunization rate and higher the death rate. So much so that David Leonhardt of the New York Times used to just call it red COVID. And so why did this happen? It started at the CPAC Conference of Conservatives held in Dallas in July of 2021, where the rhetoric was, first they're going to vaccinate you, then they're going to take away your guns and your Bibles. And so, as ridiculous as that sounds to us, people in our state of Texas accepted it. And what they did at that CPAC conference, they brought in all of these, the most vicious, awful anti-vaccine activists you could imagine. And what they did was, in their zeal to push back against vaccine mandates under this banner of health freedom, medical freedom, they went the next measure and they falsely discredited the effectiveness and safety of vaccines. They basically said vaccines don't work, they're not safe. It was all nonsense. But that's what really took off. In fact, the Associated Press, about that CPAC conference in Dallas in July of 2021, right at the start of the Delta wave, the title of the article was "They Clapped at Death for COVID." And that's what we were dealing with. And then the pylon came. The pylon came from the House Freedom Caucus. Representative Marjorie Taylor Greene of Georgia called people like me medical brown shirts, comparing vaccines to the Holocaust. Representative Jim Jordan of Ohio piled on. Senator Rand Paul started attacking the vaccine scientists, attacking me, writing nonsense about me even in his book. Senator Ron Johnson of Wisconsin held these phony baloney vaccine injury roundtables and started going on interviews, public interviews with the most virulent anti-vaccine activists. And then I'll stop in a minute. Very importantly, amplified every night on Fox News. And this was documented by two groups, Media Matters, a watchdog group, and a research group out of ETH Zurich, the Federal University of Science and Technology in Switzerland, where Einstein studied, documented that every night during that Delta wave, Tucker Carlson, Laura Ingraham, Sean Hannity, the most widely watched opinion news broadcast in America, 3 million viewers every night, falsely discredited the effectiveness and safety of vaccine. They filled that stuff with anti-vaccine content. Then you had Joe Rogan, the podcaster, bring out all the virulent anti-vaccine activists in the last half of 2021. So what happened was, you were watching all this stuff and you just went down that rabbit hole and you paid for it with your life. So these were victims of what we too often call misinformation or infodemic. And what I'd say, it's none of those things. It was organized, it was deliberate, it was predatory, it was politically motivated, and it killed 200,000 Americans. So how do we have that conversation? Because now it's extending to all vaccines. And in a bit, we can talk about the now revisionist history that's happening now in the House because of it. So the point is, the anti-vaccine movement got adopted by the extremist elements of the GOP, of the Republican Party. And the reason now, I feel, as a vaccine scientist, making vaccines is one thing. That's what I set out to do as an MD, PhD scientist here at Baylor and Texas Children's, to make vaccines that the big pharma companies won't make for the world's poorest people. But now I feel combating anti-vaccine activism may be just as important in terms of saving lives as making the vaccines themselves. But it's a very scary, dark place, because, I've got now Steve Bannon publicly declaring me a criminal, for instance. And, when Steve Bannon calls you a criminal, that's pretty serious stuff, right? It comes from an authoritative source. And then you have Roger Stone goes after me, and all of the far right politicians, I'm basically portrayed as a public enemy or an enemy of the state, which is the next wave of the anti-vaccine movement.
Yeah. So you have delved into history, and it is interesting that when you step back, there's these cycles of history for all kinds of socio-political events. And I think that you see you've told me you've seen some parallels with history. And so do you want to talk more about that?
Yeah, and I read about it in the book. There's a chapter that looks at the historical basis of this, and it's unfortunate. It's a very dark chapter because it brings us back to fascism in the 20th century. And it has to do with the fact that it's not only targeting the science, but again, this business of portraying American virologists and scientists as public enemies or enemies of the state. And this is what Stalin did, right? Stalin, threw the Mendelian geneticist Vavilov in the Gulag in favor of Trofim Lysenko and his phony vernalization Lamarckian theories that wound up destroying a lot of the Ukrainian and Russian wheat crops and caused massive starvation. But the point is, he felt the need to target the intelligentsia, beginning with the scientists, to portray them as enemies. And this is a signature of authoritarianism. And that's what the far right element of the GOP is all about. It's all about authoritarian control, in my view. And so we're seeing the similar kinds of attacks on science and scientists with Viktor Orban in Hungary, for instance, another authoritarian regime. When Bolsonaro was in power in Brazil, we saw it that way. Same kind of thing wouldn't happen. I mean, Bolsonaro went out of his way to publicly say he wasn't getting vaccinated, and other far right authoritarian regimes. And this is what Putin does as well. And Putin is actually one of the biggest purveyors of anti-vaccine disinformation. So and the Putin ties are very real. And so this is now a signature of authoritarianism. And you want to just pull your hair out because you want to say, again, I don't care about your political views, but don't adopt this one. But somehow it's gotten intertwined with all the other stuff, right? About January 6th, it was, a walk in the park, and the election was stolen, and Putin over Ukraine. And now vaccines are dangerous political instruments of control. And how do you say, don't take this one on because you're going to die? And again, it killed 200,000 Americans. And you're seeing this play out now in other ways. So, and here in Texas too, you had the Texas Attorney General, Ken Paxton, just recently launched a lawsuit against Pfizer for the mRNA vaccine. Why? Because he says, well, as many Texans died after the vaccines became available as before. Well, yeah, but that's because 40,000 Texans died because they were targeted victims of this anti-vaccine campaign. I mean, it's nuts. And then just reported in the Houston Chronicle this week, a school district near Houston is now going to remove all mention of vaccines from their science textbook. And this is just craziness. And I worry it's extending to other aspects of biomedical science. And this is what's playing out now in the House of Representatives in the U.S. Congress. They're holding these COVID subcommittee, and on their official Twitter site, it literally says, "quote unquote," we're going to sell popcorn. They're not even pretending this is anything other than political theater and Fox News sound bites. But what they're doing is they're hauling prominent virologists and other scientists in front of C-SPAN cameras to humiliate them. And what they're doing is they're practicing revisionist history. Now that I've pointed out how 200,000 Americans have needlessly perished because of these activities, the revisionist history says, no, it was the COVID vaccines that killed Americans, which is absolute nonsense. But yet they're trying to make that case. And or they'll say the scientists invented the virus in the first place through gain of function research and this kind of stuff. Absolute nonsense. But it's an attempt to revise history. So this is continuing to escalate up until the fall election. So what I say is, look, I didn't politicize vaccines or all this stuff. They did. I'm, literally trying to say, how do we uncouple the anti-science from it? Because, historically, there's nothing necessarily anti-science about the Republican Party, right? Lincoln started the National Academy of Sciences. Eisenhower launched NASA. When I came to Texas 13, 14 years ago, I used to call them George H.W. Bush, Jim Baker Republicans. And I got to meet Jim and Susan Baker multiple times, fantastic people. And I didn't always agree about their political views, but I never doubted they cared about the country. I never doubted they loved the Texas Medical Center. They supported science, and they recognized that Texas, to be a great state, it has to become a state of science and innovation and help build our Texas Medical Center. But this new stuff is all dark and twisted, and I just don't understand it.
So we do have a question from the audience. How should society respond to Robert Kennedy Jr.'s political campaign, which is leaning in on his longtime anti-vax and further normalizing it?
Yeah, Robert F. Kennedy Jr. I've had a long history with him since 2017 anyway. So back in 2017, when Robert F. Kennedy Jr. came out right before Donald Trump was about to be inaugurated and said he was going to be appointed head of a vaccine commission. And we all sort of rolled our eyes because we knew that was going to be a disaster. The next day, my assistant says to me, "Hey, Dr. Hotez, I have Dr. Francis Collins and Anthony Fauci on the phone. Can you talk to them?" And I said, "Yeah, I think so." And they basically said, "Peter, we got a job for you." And I said, "What is it?" And I said, "We want you to talk to Robert F. Kennedy Jr. because you have a daughter with autism. You can explain why vaccines don't cause autism. Maybe you could talk them off the ledge." And I said, "Sure, anything for the NIH, right?" And they had it brokered by Tim Shriver, who heads the Special Olympics, who was fantastic. So I had a series of long conversations with him on cell phone, taking walks with my wife. She often heard some of the conversations, and he was just dug in. He wasn't interested in the science. He couldn't understand the science. He was just he was a political zealot and just wanted to talk and came up with these random facts and factoids that weren't even true. And so I knew, and so it didn't really get anywhere. They were not productive discussions. So, and then at the start of the pandemic, he went after me, started publicly declaring me the OG villain, which I'm so old and square, I had to look up what that meant, the original gangster villain. And then the pylon came last year around this time, in June of last year. I got publicly challenged to debate Robert F. Kennedy Jr. By Joe Rogan, the podcaster, together with Elon Musk and a couple of other of his tech bro billionaire friends. I mean, basically, as I like to say, every follower on Twitter except those following Taylor Swift were on my case. And the reason I didn't want to, and they even tried to bribe me. They tried to, Joe Rogan said he'd give me $100,000, and Elon Musk, I think, said he would match it. This kind of nonsense. And so what were the reasons why I wouldn't debate him? One was when I had those conversations with him, over the years, and knew they weren't going to be productive. I also didn't want to help his presidential candidacy because Molly Jong-Fast, the columnist and journalist, pointed out that the reason the tech bro billionaires were pushing me to debate him was they wanted me to legitimize him as a serious presidential contender, which they thought would take Biden votes away. So they thought this was sort of a backdoor way to help President Trump, get a victory. And I didn't want to be part of that process at all. And I didn't want to help Robert F. Kennedy Jr. But the third reason, and really the major reason that I didn't want to debate him, is it sent the wrong message to young people, especially about how we do science. Science is not something that we advance through public debates, especially with nefarious characters like Robert F. Kennedy Jr., right? I mean, we have a way of doing science, right? We I mean, I'm dealing with reviewer three's comments on my major revision right now, in fact. And so we write our papers, right? And sometimes, it's a struggle to take care of the major revisions and get them published. It's work, right, to do this. And we get grants that get not discussed at NIH study section, and we have to revise our grants. And we present at scientific meetings in front of our peers. And oftentimes they're very pleasant interchanges. Sometimes it can get pretty rough. But that approach has worked for hundreds of years since the founding of the Royal Society in the 1600s and been fine-tuned ever since. I can't think of an instance where we'd really advanced science through public debate. I mean, you had, Niels Bohr and Einstein sit in public discussions, but those were two esteemed colleagues that valued each other, right? Who were both accomplished physicists. And it wasn't really a debate. It was just an open discussion. You debate politics, you debate 18th century Enlightenment philosophy, but you don't debate science. At least I can't think of really an example where you've advanced it. So I didn't want to send that message that, just because you have some clever lawyer who makes up stuff, that wins the day in science. That would send the wrong message. Anyway, the pylon was just pretty brutal lasted for months. And, people have been stalking me at lectures and things like that for years, but then people started coming to my home, and I think it was even on Father's Day, they came to my home and this kind of stuff. So it's gotten to be a very dark chapter in US science history.
I agree. And it's really unfortunate that you and your family have had to suffer for these really important views that you're trying to
they
get.
stalk Rachel at work. She works at Goodwill, on the corner of Westheimer and Shepherd. She works there two hours a day sorting clothes, and they come up to her and this kind of stuff. It's these people, no filter.
Yeah. So, it's 2020 hindsight. So, looking back on the pandemic, are there lessons learned that, God forbid, if we have another pandemic, things that you would advise the administration, advise other scientists to do differently?
Yeah, there's a lot of hand-wringing about how the pandemic went, especially in the United States. I'd say there's also a lot of good that happened. My friend and colleague, Alison Galvani, who's at Yale, did an estimate that the COVID vaccines in the United States saved 3 million lives. So instead of 1.2 million Americans dying, it could have been 4.2 million Americans dying, and another 18 million hospitalizations averted. So, and vaccines, I think, reduce tremendously the burden of long COVID as well in the United States. So that, I think we have to keep that in mind, and not, because I think now there's a lot of doomism out there that says we totally screwed up this pandemic. And yes, there were mistakes, and I'm going to talk about them now. But for me, the big picture was, overall fairly successful. I would have liked to have seen greater commitment to global health equity, greater support for our vaccines. I mean, we didn't get any help from Operation Warp Speed because we weren't a pharma company. So we, with Baylor Ventures and Baylor Licensing, we were on our own. And, India and Indonesia and Bangladesh adopted our vaccines. And 100 million people got vaccinated. So we were grateful. Our Texas Children's Hospital Center for Vaccine Development, co-headed by myself and Mary Elena Patazzi, and our team of 20 scientists. That was very gratifying to be able to make that contribution. But we could have gone faster if we had more help. I think, some of the communication could have been improved. It actually wasn't terrible, but there were mistakes. I think one of the big mistakes made was in Operation Warp Speed, there was no limits on how the pharma companies communicated. So, for instance, Moderna and Pfizer would send up these press releases. And then when I was going on the cable news channels, I was, pulling my hair out, because what Moderna and Pfizer were doing were, when they write a press release, they don't write it for you or for me. They write it for their shareholders, right, to jack up their stock prices. And what they were doing was spectacularizing their accomplishments. They were basically saying, aren't we great? Look at how these vaccines, we pulled them out of nowhere, and now we're saving lives. That's what an amazing company we are. Well, no, it wasn't the case. It was those vaccines were built on 15, 20 years of research on mRNA technology and showing, pseudouridine, putting in for uridine will reduce, TLR3 signaling, and work done at University of Pennsylvania that ultimately was awarded the Nobel Prize, or our work showing that the spike protein is the target of the virus, how you deliver the spike protein in different adjuvants, and all that work went into mRNA vaccines. That was 20 years of research, and which is about the right time frame for a lot of these vaccines. But that was a missed opportunity. So in their effort to spectacularize their results, they scared the American people, right? And so people started questioning, how could these vaccines be legit, popping out of nowhere? And of course, the anti-vaccine guys really weaponized it. And then I think there were things like if you remember, when the 2 doses rolled out, they said 3 weeks for Pfizer, 4 weeks for Moderna, and then then everybody gets their get out of jail free card. And I thought, well, no. I mean, if you look at most pediatric immunizations, we give 2 doses, we wait 6 months or a year, and then boost, and that's what gives you more enduring immunity. And sure enough, that was the case during the Delta and the BA.1 Omicron wave. We needed a boost, and I know I said we're going to need it, but that required a lot of alterations in the message, which confused people. And even then, it turned out 3 wasn't enough because the mRNA technology wasn't holding up as well as we had thought, and possibly because it's not inducing long-living plasma cells and in the bone marrow. So because of that, now we need more frequent boosters. So there should have been enough language in there in the beginning to say we really don't know how durable the immunity is going to be. And then there were confusing messages about what's the performance features of these vaccines. They were rolled out to stop symptomatic illness. Then, because we weren't measuring vaccine effectiveness early on in the pandemic, we were relying on the Brits and the Israelis to do that. Israel came up with data showing that with the original lineage and the alpha lineage, we were getting 90% protection, not only against symptomatic illness, but asymptomatic illness. It was stopping virus shedding. Virus neutralizing antibodies were so high, they were getting into the nose and throat mucosa and therefore stopping virus shedding, and therefore the mask can come off. And that was the reason the mask can come off. But the CDC never explained it that way, right? They just said, okay, now masks can come off. And that was a mistake by not giving underlying assumptions when vaccine immunity started to wane, as it did pretty quickly, and the virus mutated to Delta and then BA.1. Then it still had some impact on reducing transmission, virus shedding, but not nearly as much. And the masks had to come back on. And the CDC had this way of communicating that's the old-fashioned way of communicating, that we have to talk to the American people like we're in the 4th grade or the 6th grade and not give underlying assumptions. I think that was a big mistake in terms of how they communicated. So there were definitely errors in communication, but overall, I think the pandemic, a lot of lives were saved as well.
Yeah, that's a great way to frame it. We have additional complexities, being in Texas, and the politics that are here are really magnified. You alluded to that earlier. So do you have advice for people when they're asked to comment about not only vaccines, but let's say about women's health or other health issues being in Texas? Is there anything that you would advise people to do or not do?
Yeah, it's especially complicated because we do want to have good relationships with the Texas legislature. And so I personally find it easier to criticize national figures than I do Texas elected officials because of the potential consequences to the medical center. So if you noticed, a lot of my I have no problem talking about what the House Freedom Caucus is doing, or Senator Ron Johnson or Rand Paul or Fox News or Joe Rogan and things like that. I try to be a little more careful when I'm criticizing Texas elected leaders for a couple of reasons. One, I often think, well, look, if I really care enough, I have access to those Texas elected leaders, right? And most of us do, right? We can call those individuals and have a discussion with them. And I sometimes think that can be more productive than just throwing darts in public. I think the other is the worry is, what it means for retribution to Texas Children's Hospital or Baylor College, many of the TMC institutions. And so what I say is before openly criticizing an elected official in Texas or Texas policy, have a conversation with your Office of Communication. Try to get a sense from them what would what they feel comfortable with what they don't feel comfortable with, because it could backfire. I mean, and in generally speaking, if you want to do public engagement, it's a good idea to have a conversation with your Office of Communications and Public Outreach, because if you do it enough, you'll eventually screw it up. And it happens to everyone, and if you're doing public engagement enough, you'll mess up. And you don't want the first time you meet your Office of Communications after you mess up. It's good to have that working relationship with them so they have your back too. So I think that's extremely important as well. But it is tough. We have a lot of unique challenges here. But we also have, a lot of blessings too. I mean, I couldn't do what I do in terms of vaccine development, making 100 million doses. I couldn't do that at most academic health centers in California and the Northeast. You can do things in Texas that you can't do elsewhere. So, Texas is, the way I say it is, Texas is an interesting state because it has the two extremes, right? It has the TMC institutions, the best of biomedicine, but it also has the extreme politics, and it has gotten more extreme. And so it does have its challenges. But for me, the benefits still outweigh the risks. But not the right statement. The benefits outweigh the downside.
Yeah. So I really like your idea of trying to do local things. So calling your local representative. Can you talk a little bit about?
And by the way, and work with your government affairs people. I mean, we at Baylor College of Medicine, we have both Herb Buttram, who does more of the national stuff, and Brian Jammer on the local. Get to know them. They're fantastic individuals. You'll learn a lot from them. Same thing with the Texas Children's side, Jonah Carlson, and have a relationship with them as well, because they often will have access that you don't, or they may be able to tell you things that you may not have been thinking about. So take advantage of those resources as well. And that's probably true of most of the TMC institutions.
Yeah, that's really good advice. I've gotten very good help from Herb Buttram. So in my role at the VA, I'm not allowed to, lobby and advocate, but Herb and Baylor have advocated on behalf of VA. So that's a good tip. We just have a couple more minutes. If there's anyone that would like to ask a question, please put it in the Q&A. Otherwise, I'm going to ask Peter if you could just talk about maybe an example of a conversation with a local elected leader that you feel like pushed the conversation forward in a positive way. I do know that Lizzie Fletcher nominated you for a Nobel Prize, so you must have a good relationship with her.
Yeah, I've gotten to know a fair number of members of the Texas delegation, and if people like, especially on the Dem side, Sheila Jackson Lee or Lizzie Fletcher, they're all in. I mean, that's fairly straightforward. You can easily have a candid discussion with them. But the harder part, but for me, the more interesting part is talking to Republican leaders. And what's interesting about them is most of them are quite reasonable and very committed to science and medicine, ... But they say it in private. They feel constrained about going too public with that because they don't want to offend the wackadoodle base. And so that can be frustrating sometimes. But especially sort of the old school Texas elected leaders, they're Texas politicians, Republicans. They're terrific. They're all in. And they themselves are trying to figure out how to navigate this new space, and you learn that by having those conversations with people, and that's good to know as well.
Well, thank you so much. This time has just flown by for me. I always enjoy hearing about your very courageous battles on behalf of science and those who do not have access to healthcare throughout the world. There's many comments saying people are grateful for your dedication, for supporting under-resourced communities in spite of significant personal risk. And thank you, another one, for your clear thinking, your advocacy, and courage. So,
Well, thank you. I couldn't do what I do without, having my colleagues at Baylor College of Medicine, Texas Children's, really the whole TMC, at having my back. And, I gave grand rounds at MD Anderson not long ago, and they're fantastic Houston Methodists. So this is an extraordinary place to be. I think all of us are trying to figure out how, and in the last discussion from Susan Rain, I think she said it, very well. How do we, do the best we can for our patients in navigating this very complicated landscape? And as long as we are really true to ourselves and can make that case that we're doing the very best we can for our patients, for medicine, or for science, I think we'll come out ahead. But the sledding is going to continue to be rough, I think, for the foreseeable future. I certainly don't see this getting better up until the national election. What happens after that? Who knows? I mean, I think that's, again, there's no roadmap here, which also makes it kind of interesting. One of the last things I'll say is I sometimes, get approached by some of the residents or medical students or fellows or even junior faculty, and basically they look at me like Moses in the desert. Why did you bring us here? And I say, look, you could be at Penn, you could be at Harvard, you could be at UCSF where everybody agrees with you, or you could be here making a big difference, and that's another way to look at it as well.
Well, thank you, and thanks for being here at Baylor College of Medicine. Thanks for being here with us today, Peter.
Thank you, and thank you for all your great work, Laura.
Thank you.